stop. If your blood sugar keeps climbing, no matter how perfect you are, what I'm about to say will either light a fire in your chest or finally set you free. For 24 years as a surgeon, I have watched good people follow every rule, swallow every pill, cut out every treat, and still watch their numbers spiral out of control. Here is the truth nobody wants to tell you. You are not failing. Your doctor is not lying. You are just fighting the wrong enemy. Right now, this very second, there is a 90% chance your cells are slamming the door on insulin, and it has nothing to do with what you ate. It has to do with something so basic, so painfully obvious, that it has been hiding in plain sight your whole life. The medical system will never make it a priority because there is no drug for it, no surgery, no fancy billable code, but I have watched it drag fasting glucose down by 50 points in 2 weeks without changing a single meal. I am Dr. Megan Foster, 24 years of cutting people open and fixing what is broken. And what I am about to lay on you is not experimental, not controversial, just basic physiology the powers that be ignore because it does not stuff their wallets. This is the missing switch that decides whether insulin can even do its job before food or medicine ever show up. And if some expert told you your only choice was more starvation or stronger meds, that nonsense ends right now. Here's the real deal. The problem is usually not what you eat. It is how thirsty your cells are. Blood sugar does not spike only because sugar enters your blood. It spikes because the sugar cannot get inside your cells. And one of the fastest ways insulin stops working is when your cells are bone dry. Same meals, same pills, wildly different numbers, all depending on how much water is actually inside your cells. That little twist changes everything. We are not throwing out your treatment. We are fixing the inner soil your treatment grows in. By the end of this video, you will finally get why fasting glucose goes wild as you age, why the timing of your water hits harder than the volume, why ice-cold water can actually wreck your morning reading, and how a simple drink schedule can steady your blood sugar without one single new rule in your life. This is real. This is body science, and you can start the moment this video ends. Now, before we roll any deeper, if calm no-nonsense truth like this matters to you, smash that subscribe button. I read every comment, and if this lands for you as we go, just type the word approved, and I will know it hit home. Let us crack open what is really going on and why water matters more after 60 than almost anyone ever explains. Most folks over 65 are walking around chronically dehydrated, and they do not even feel thirsty. That is not a guess. That is a measurable fact. And dehydration makes blood sugar control an uphill nightmare no matter how clean you eat or how many pills you pop. And yet almost nobody talks about when you drink. They treat water like some nice-to-have wellness fluff. It is not fluff. It is the foundation. As you age, 4 brutal things happen that make staying hydrated way harder than it used to be. First, the tiny water doors in your cells, called aquaporins, get lazy. These are the little gates that let water pour in. When they slow down, your cells stay dry even when you are chugging water all day. Second, your kidneys lose their grip. They cannot hold on to water the way they did when you were 30. Third, your thirst signal flatlines and shows up late to the party. By the time your mouth feels dry, you have been dehydrated for hours. And fourth, the very pills you take for blood pressure and blood sugar pull water right out of you as part of how they work. So you can be drowning on the inside with 0 signs. No dry mouth, nothing obvious, just blood sugar climbing for no reason anyone bothers to connect. Now here is why that matters so much. Even mild dehydration makes the walls of your cells stiff. Stiff cells fight insulin. The sugar sits in your blood not because you cheated on dinner, but because your cells physically cannot swallow it. Think of insulin like a key and your cell like a lock. If the lock is rusted shut, the key is useless. That is why your numbers climb even when you do everything right. The food is not the villain. The med is not broken. The inside of your body has changed. Once you see that, every other puzzle piece starts to fit. Let me show you what I mean with a real person. Mark, 72. Mark's fasting glucose had been steady for years, parked right around 120. Then one day it shot up into the 180s. No new foods, no missed pills, no clue from his doctor except the usual shrug and some talk about age and disease marching on. When we dug deeper, Mark was barely drinking 2 glasses of plain water a day, Everything else was coffee, which is a sneaky diuretic that drags water out of you, or juice, which is basically liquid sugar. We changed nothing about his food, nothing about his meds, only when he drank and how warm his water was. Inside of 2 weeks, his morning readings tumbled into the low 130s and held there like glue. Same food, same meds, wildly different numbers. That is the power of aiming at the right target. Now grab hold of this little bombshell. Blood sugar chaos is usually a water problem, not a food problem. When your cells are swimming in water, insulin works like a charm. When they are parched, nothing else matters. You can eat like a saint. You can take every pill on the dot. But if your cells are dry, the sugar has nowhere to land. It is like trying to pour water into a bottle with the cap screwed on. The water is fine. The bottle is shut. Yet almost every plan out there obsesses over what you are pouring and totally ignores whether the bottle can even open. Let me show you the 3 dumbest hydration mistakes most folks over 60 make every single day. Mistakes that quietly torch your blood sugar without you ever noticing. Number 1, counting your coffee, tea, or juice as water. These drinks do different things to your body. Coffee drags water out. Juice sends your sugar through the roof. Tea can be fine, but it is not the same animal as plain water for feeding your cells. Your cells want water, not flavored fog. Number 2, chugging ice-cold water, especially first thing in the morning. Cold water tightens your blood vessels. Less flow means less sugar getting into your cells. Room temp or slightly warm water slips in way smoother and does the job way better. And number 3, waiting until you are thirsty to finally drink. By the time thirst hits, you are already in the danger zone. Your cells are already fighting you. You are playing catch up instead of staying ahead of the game. These habits are sneaky. Nobody told you they mattered, but they do. Big time. So what is the fix? I call it the WTR protocol. W for water quality, T for timing, R for regulation and reset. Let us break it open so you can roll this out starting tomorrow. First up, water quality. Filtered water is the dream. Tap water works fine, but filtering scrubs out junk that can mess with how well you absorb it. And here's the part that flips the switch. Minerals matter, big time, especially magnesium, potassium, and sodium. Why? Because moving sugar into your cells is an electrical job. Insulin tells the cell to open up. That message runs on electricity. Strip out the minerals and the signal gets weak and fuzzy. A tiny pinch of good sea salt or a drop of mineral liquid in your water supercharges how well your cells drink it up. You do not need fancy gear, just mineralized water. Now timing. This is where 90% of people screw it up. It is not about guzzling more. It is about when. There are 4 sweet spots that steady blood sugar way better than random sipping all day. First, the moment you wake up. Room temp, 12 to 16 ounces. This refills you after the long dry night, calms the cortisol spike that dumps sugar into your blood, and wakes your cells up ready for insulin. Second, 30 minutes before each meal, 8 to 12 ounces. This gets blood flowing to your gut, slows down how fast carbs crash in, and blocks those nasty after-meal spikes. Third, mid-morning and mid-afternoon, 8 ounces each. This keeps the river running and stops the slow drain that wrecks your afternoon numbers. And fourth, 2 to 3 hours after your last meal of the day, 8 ounces. This helps your kidneys do their overnight housekeeping without busting up your sleep. Same water, different clock. Wildly different result. Here's why the timing magic works. It boosts blood flow. Watery blood is thinner and faster. Insulin reaches your cells quicker. It dials down the cortisol gamble. Dryness is a stress bomb. Stress hormones shoot blood sugar up. Hydration dials the stress down. It slows carb entry. Water before meals softens your stomach acid a touch and slows how fast food dumps into your gut. That flattens your sugar curve, and it steadies both morning and after meal readings. Steady water in, steady body response out. Your cells stop guessing and start knowing what is coming. Now I know what you are thinking. Great, I will be peeing every 15 minutes at first. Yes, you will, and that is totally fine. That is your body recalibrating. For the first week, maybe 10 days, you will be making extra bathroom trips. That is not a problem. That is your system rebooting. In 10 to 14 days, your kidneys, bladder, and cells sync back up, your sugar swings calm down, your head clears, your energy steadies. The bathroom hassle is short-term. The payoff lasts. This is the regulation phase. Your body is learning to hold water the right way again. It is waking up those lazy aquaporin doors. It is teaching your kidneys to filter smart. instead of wasteful. Stick with it. Trust the grind. Let me show you what to expect week by week so you are not flying blind. Week 1, more bathroom runs, tiny shifts in your numbers, maybe a small drop, maybe nada. That is normal. Your body is getting used to the new normal. Week 2, your numbers stop ping-ponging. Your fasting glucose starts to settle. After meal spikes shrink. You will feel the change. Week 3, the real magic shows up. Most folks see their morning numbers drop into a friendlier range. Wake-ups become predictable again. And week 4 and beyond, your A1C starts to move in the right direction under your doctor's watch. This is when labs finally catch up to how good you already feel. Steady water builds, steady wins. Let me hand you another real story. Elaine, 75. Elaine's A1C crept from 7.9 up to 8.8 over 6 months. Her doctor was about to put her on insulin. She was freaking out. She thought she had failed at life. When we checked her water habits, she was bone dry and did not even know it. Maybe 1 glass of water a day. Rest was diet soda and decaf coffee. We rolled out the 4-window plan, added minerals, room temp water. 3 months later, her A1C slid down to 7.4. No new meds, no crazy diet, just giving her body the wet conditions it needed to actually use the meds she was already on. That is what happens when you fix the basics. Now let me bust a few stubborn myths that drive me nuts. Myth 1, if I am not thirsty, I do not need water. Wrong. Thirst is a late warning light. By the time it blinks on after 60, you have been dry for hours. Myth 2, water with meals washes out your digestive juices and is bad. Nope. Water before meals helps. Water during meals in moderation is totally fine. Your stomach acid is a beast. Myth 3, I can get all my water from food. Fruits and veggies have water, sure, but it is never enough for your cells, especially as you age. You need plain water. And myth 4, everyone needs 8 glasses a day. The amount shifts based on your size, how active you are, your meds, the weather. The 4-window pattern matters way more than chasing some magic number. Here is something most people miss. In winter, you naturally drink less because you are not hot and sweaty, but your furnace is sucking moisture out of the air all day long and your body pays the bill. Winter dehydration is real and meaner than summer dehydration because you cannot see it. You are not sweating, so you do not think about it, but your blood sugar knows the difference. I see more chaos in January and February than any other stretch. Not the holidays, those are November and December. It is the post-holiday dry season that wrecks people. So in winter, you actually need to try harder with water, not slack off. Summer throws a different curveball. You sweat more, you lose minerals faster. This is when a pinch of sea salt stops being optional and becomes essential. Without those electrolytes, you can chug water all day and still feel like a dried-out raisin because there is nothing in your blood to hold the water inside your cells. It just whooshes right through. I have watched people drink gallons and still feel parched and still see sky-high sugar. It is the minerals. Always the minerals. Let me tell you about George, 73. George was doing everything right. Eating clean, walking daily, taking his meds on schedule. Yet, his morning fasting numbers kept parking in the 150s. He was fed up. Turns out George was slamming a full liter of water right before bed because he heard hydration was the holy grail. But he was waking up 3 times a night to pee. His sleep was shredded. Bad sleep was dumping cortisol into his morning blood, and that was jacking his fasting glucose sky high. We shifted that liter into the 4 windows and capped his night water at just 8 ounces, 2 hours before bed. 10 days in, he was sleeping through the night like a baby. 3 weeks in, his fasting glucose had melted into the low 120s. Same total water, totally different clock, totally different result. Here is something nobody tells you about checking your blood sugar. Consistency of your readings matters way more than chasing every spike. If your fasting glucose sits at 130 every single morning, that is actually better than bouncing between 90 and 180 like a ping pong ball. Consistency means your body knows what is coming and can adapt. Chaos means constant stress and recalibration. Structured hydration builds consistency. Your cells start expecting the water. Your insulin response gets predictable. That is why week 3 is when the big wins show up. Your body has memorized the new pattern. Now let us talk pills for a second. Some blood pressure meds are diuretics. They make you pee more. If you are on those, you need to be even more stubborn about hydrating. But here's the trick. You have to space it smart. Do not flood yourself right after taking a diuretic. It just blasts right through. Sip steady through the day, let your body soak it in, and talk to your doctor. Some folks on water pills actually need their dose dialed down once they start hydrating, right? Because their blood pressure drops on its own. This happened with 3 of my own patients. Better water habits, better blood pressure, less medication needed. Always under a doctor's eye, but it happens for real. Here's a question I get all the time. What about coffee? I love my coffee. Can I still have it? Yes, but know the game. Coffee is a diuretic. For every cup you sip, you owe your body an extra 8 ounces of plain water to make up for it. So 2 cups of morning coffee means 16 ounces of payback water on top of your regular plan. And never count coffee as one of your 4 windows. Water is water. Coffee is coffee. 2 different jobs in your body. Let me share something personal. Early in my career, I barely thought about hydration. It felt too basic, too boring. I was chasing the fancy stuff, surgical techniques, advanced drug protocols, cutting-edge diagnostics. But the pattern kept slapping me in the face. Patients who hydrated well bounced back faster from surgery. Their wounds healed cleaner. Their blood pressure was steadier. Their blood sugar was easier to tame. It was undeniable. I had been so busy admiring the shiny second floor that I ignored the cracked foundation underneath. Once I started teaching this stuff, the results screamed for themselves. I am sharing this because I want you to know I learned it the same way you are about to. Through watching, through testing, through results you cannot argue with. And here is a little hack about accountability. Find a buddy for this. A spouse, a friend, a sibling. Check in with each other. Did you do your morning water? How are the numbers today? This is not about pressure. It is about backup. My most successful patients had partners doing it with them. Even when the partner did not have diabetes, they leveled up too. Everybody wins. Now let me be crystal clear about something. This is not a cure. Never quit your meds without your doctor on board. If you carry heart failure, kidney disease, or live on diuretics, talk to your physician first. Hydration can shift your med levels and fluid balance. You need a guide. Watch for overhydration red flags like puffy ankles, sudden weight gain, pounding headaches, queasy stomach. These are rare if you follow the plan, but they can happen. Adjust gently. Listen to your body. We are backing up your treatment, not replacing it. Here is how to track this the right way. Grab a plain notebook. No apps, no fancy systems, just paper and a pen. Each day jot down the date, tick off your 4 water windows, and write your blood sugar. Morning fast, 2 hours after breakfast before bed. That is the whole job. After 2 weeks, stare at the pattern. You will see the link. You will see how good hydration days line up with better readings. That visual proof keeps you moving when your willpower gets soft. Let me tell you about the folks who struggle with this. Usually, it is not because the plan fails. It is because they make it way too complicated. They drop $1,000 on some alkaline water shrine. They obsess over the perfect mineral ratio. They try to be flawless. Stop that. Simple wins. Filtered water or clean tap, both work. A pinch of sea salt works. 4 times a day works. Perfect is the enemy of progress. Start easy. Stay steady. Results chase you. Here's a quick troubleshooting guide if things feel stuck. If you are hydrating right but still no wins after 3 weeks, eyeball these. 1. Are you actually drinking room temp water or still going cold? Temperature matters. 2. Are you adding minerals or just plain water? Minerals matter. 3. Are you hitting the windows or just sipping randomly all day? Timing matters. 4. Are you making up for your coffee and dehydrating meds? Payback matters. And 5. Are you actually sleeping enough? Sleep runs the whole show. If you nail all 5 and still see nothing, then it is time to look at other angles with your doctor. Here is what happens long-term when you keep this up. Your body gets tougher. You handle stress better. You handle the occasional birthday cake better. You handle schedule blow-ups better because your foundation is rock solid. I have had patients tell me they can now eat a slice of cake at the grandkid party without their sugar going bonkers because their baseline hydration keeps their cells wide awake. That is freedom. That is the real payoff. Not perfection, resilience. And let us talk about what this means for your family. When your kids or grandkids see you grabbing the wheel, rolling out something this simple, and watching the winds roll in, you are teaching them something huge. You are showing them that health does not have to be a brain teaser. That small, steady moves matter. That bodies answer when you give them what they need. You are modeling healthy aging. That is a gift that outlasts any blood sugar number. That is legacy. Here is my final dare. Do not just toy with this for 2 weeks. Commit for 90 days. That is how long real cellular change takes. That is how long it takes to see A1C shifts. That is how long to truly know if this works for your body. 90 days of 4 windows, 90 days of minerals, 90 days of room temp water, 90 days of tracking. If after 90 days there is 0 change, we reassess. But I have never seen someone run this plan right for 90 days without measurable wins. Not once. Now let us get practical. How do you actually do this? Pick one window this week, just one, the easiest one. Most folks pick wake up. Set a glass of room temp water on your nightstand tonight. Drink it first thing tomorrow. Do that for 3 days, then add the before lunch window, 30 minutes out. Do that 3 days, then add mid-morning, then mid-afternoon, then evening. Stack it slow. Let your body catch up. Do not try to overhaul everything at once. This is not a race. It is a reset. Here is your shopping list. A water filter if you can swing it. Not required, but handy. Some trace minerals. Sea salt works perfectly. Mineral drops work perfectly. A pinch in each glass. A reusable water bottle with measurements so you can see your ounces without guessing. And a simple tracking sheet. Just check boxes for each window each day. Keeps you honest without feeling like homework. Now let me hit the questions I get the most. First, what if I forget a window? Totally fine. Do not double up. Just pick up at the next one. Consistency beats perfection every time. Second, can I drink more than the recommended ounces? Sure, but ramp up slow. Do not leap from 2 glasses a day to 12. Your body cannot handle that. Build gently. Third, what if I already drink plenty of water? Then focus on timing and temperature. You already have the volume. You just need the structure. Fourth, does this work if I am on dialysis or have serious kidney disease? No. This plan is not for you. You need your doctor calling every shot on fluids. Talk to your nephrologist. And fifth, how long until I see wins? Most folks feel steadier energy and clearer thinking inside a week. Blood sugar shifts usually show up in week 2 or 3. A1C takes 3 months because the test averages 3 months of glucose. Be patient. Your body is healing. That eats time. Let us talk about the other gifts that show up when you hydrate right. Your skin perks up. Hydrated skin is bouncier and tougher. Your digestion smooths out. Constipation, that nasty sidekick of diabetes meds, often just vanishes. Your sleep deepens. Dry tissues wreck sleep cycles. Proper water steadies them. Your mood lifts. Dehydration cranks up anxiety and crankiness. Water calms the wiring. Your blood pressure often steadies. Thin blood is easier to pump, less work for your heart, and your kidneys level up. Kidneys need water to filter like they should. Give them what they need and they perform. These are not side effects. These are whole body bonuses from doing one thing right. Now I want to touch something deeper. The emotional toll of fighting blood sugar every single day. If you have been wrestling diabetes for years, you know the guilt, the frustration, that creeping feeling your own body is betraying you. Every high number feels like you failed. Every med bump feels like proof you are not trying hard enough. And the advice always piles on. Eat less, move more, be perfect. It is soul-crushing and often dead wrong because if the foundation is cracked, no amount of discipline patches it. You cannot willpower your way out of dry cells. You cannot positive thinking your way into working aquaporins. You have to rebuild the environment first. And that is exactly what this plan does. It gives your body the wet foundation it needs to answer everything else you are already doing. Here is the truth most people never hear. Your body wants to heal. It wants to balance your blood sugar. It wants insulin to work, but it cannot do any of that while running on empty. It is like asking a car to drive without oil. The gas is there. The engine is there, but the system seizes up. Add the oil and everything hums. That is what water is, the oil in the engine. And once it is there, every move you are already making, the food, the meds, the walks, all of it runs better. Not because you changed any of it, but because the environment changed. Your cells can finally answer. Let me share one more story. Robert, 68. Robert had been diabetic for 12 years. His fasting glucose was stuck in the 160s despite meds. He was down, convinced insulin was next. We rolled out the WTR protocol. Inside a month, his fasting glucose tumbled into the 130s. Inside 3 months, it parked in the 1-teens. His doctor actually cut his meds back. Robert cried in my office. He thought he was broken. He was not. He was just thirsty. That is all. And once we quenched that thirst, His body did what it was always built to do. It balanced, it healed, it answered. Now here is the long game. This is not a temporary patch. This is a permanent shift. Once your body recalibrates, you just maintain. You do not stop. Hydration becomes as automatic as brushing your teeth. You do not think about it. You just do it. And the wins stack up. Year 1, your blood sugar steadies. Year 2, your A1C stays in the safe zone without med increases. Year 3, you may even drop meds under supervision. Year 5, you are still steady, still thriving, still independent. That is the goal, not a quick thrill, a permanent foundation. And here's the thing about foundations. Once they are solid, you can build anything on top. Better food, more movement, less stress. But none of that works if the floor is rotten. Water is that floor. It is not flashy. It is not exciting. But it is essential, and it has been ignored for way too long. So, what is next? If this hit home, start tonight. Set a glass of room temp water on your nightstand. Drop in a pinch of sea salt. Drink it first thing tomorrow. That is step 1. Then come back and tell me what you notice. Drop the word approved in the comments if this helped. I read every single one. And if you want a deeper step-by-step roadmap for better metabolic health and longer life, I dropped my most requested longevity guide in the description and pinned comment at a steep discount. It covers way more than water, sleep, stress, food, all the pieces that matter after 60. But water is where you begin. Now let me show you something most doctors never connect. Your med timing and your water timing work together. If you take metformin in the morning, but you are bone dry, the med cannot ride through your blood the way it should. It is like trying to deliver packages during a traffic jam on the freeway. The med is there. It just cannot reach the cells that need it. I had a patient, Linda, 67, who took her diabetes meds every morning with coffee. Just coffee, no water. Her doctor kept cranking the dose higher because her numbers were stuck. When we stacked 16 ounces of water 30 minutes before her meds, then took the meds with another 8 ounces, her response to the same dose exploded. Inside a month, her doctor dropped her dose back to the original. The pills did not change. Her body's ability to use them changed. Here's something else that matters. The temperature of your water through the day runs different jobs. Morning water should be room temp or warm because your core is cooler after sleep. Cold water forces your body to burn energy warming it up, which trips stress hormones, which bumps blood sugar. It is working against you. But here is the cool twist. Later in the day, slightly cool water, not ice cold but cool, can actually help your circulation when the hours are warmer. Your body is already toasty. Cool water helps you stay in the sweet spot without shocking your system. This is the kind of fine print nobody teaches you, but it makes a real dent. Let us talk about what goes down while you sleep. Most people wake up with the highest blood sugar of the day. It is called the dawn phenomenon. Your body dumps hormones between 4 and 8 in the morning to naturally nudge your blood sugar up and wake you up. That is normal. But when you are dry, that natural nudge turns into a freight train. Your blood is thicker. Hormones are more concentrated. Your cells are already stubborn from the overnight drought. This is exactly why that glass of water on your nightstand is not optional. You are breaking the cycle within minutes of waking. You are thinning out those stress hormones. You are plumping up your cells before breakfast even shows up. And you are setting up your whole day for steadier control. Here is what shocked me most in my own practice. People who ran this plan reported better sleep within the first week. And better sleep boosts blood sugar control all on its own. It is a beautiful loop. Hydration fixes sleep. Sleep fixes insulin sensitivity. Better insulin sensitivity means smoother blood sugar. Smoother blood sugar means less nighttime chaos. Less chaos means deeper sleep. Everything hooks together. You are not just patching one hole. You are starting an avalanche of upgrades. Now I want to address the pre-diabetic crowd. If your doctor told you that you are skating the edge, this plan is even more important for you. Prediabetes is reversible in a lot of cases, but you have to catch it early and fix the basics. I have watched folks with fasting glucose in the 110s drop into the 90s inside 2 months of structured hydration stacked on the lifestyle they already had. No meds needed, just giving their body what it had been missing. This is your window to turn the ship before it becomes a life sentence. And for those of you who have carried diabetes for decades, I know you might be thinking, this sounds way too easy to actually work for you. But here's the truth. Your body never stops responding to the fundamentals just because a condition has been around a long time. I have worked with folks who have been diabetic for 20, 30 years, and structured hydration still delivered real wins. It will not cure diabetes, but it will make your treatment hit harder. It will smooth out the swings. It will hand you more predictable days, and that alone is gold. Let me hand you one more real example. Patricia, 71. Patricia had been poking her finger 4 times a day for 15 years. She knew her body. She knew her patterns. But over the past year, everything went sideways. Same meals, different numbers every time. She could not crack the code. Her doctor ran every test under the sun. Thyroid was fine. Kidneys were fine. Everything looked clean on paper. But her daily life was a mess. When we audited her routine, she was doing almost all her drinking after 6 at night because she did not want to run to the bathroom during the day. She was retired but still volunteering and hated the inconvenience. So she was bone dry all day and flooded at night, which shredded her sleep. We flipped her hydration to the front of the day. More water morning and afternoon, less at night. Inside 3 weeks, her numbers stabilized. The chaos vanished. She could plan her life again. That is what this does. It hands you back control. Here is something else I want you to get. Your kidneys are grinding harder every year. They are filtering blood, dumping waste, keeping the balance, but they cannot run that race without fuel. When you are dry, your kidneys hoard water by tightening up your urine. That is why it goes dark, but that also means they are filtering less. Junk piles up, blood sugar stays high because your kidneys cannot help clear the extra glucose. It is a terrible loop. Proper hydration lets your kidneys do their job, which hits your blood sugar directly. And let us talk about moving your body for a second. I know many of you walk or do light workouts. Awesome. But if you are dry before you move, your blood sugar can actually spike during activity instead of dropping. That confuses the heck out of people. They think exercise should always drop blood sugar. But dehydration is a stressor, and stress jacks blood sugar up. So you need to hydrate 30 minutes before you move, 8 to 12 ounces, then hydrate again after. That makes sure exercise gives you the sugar drop you are chasing. Now let us tackle the elephant. The cost. Water is not free if you are buying filtered bottles or minerals. I hear you, but look at the math. A bottle of trace mineral drops runs about $15 and lasts 3 to 4 months. That is under $5 a month. A filter pitcher runs about $30 and lasts 6 months before you need a new cartridge. We are talking pocket change compared to the cost of extra meds, extra doctor visits, or the fallout from poorly controlled blood sugar. This is the cheapest medical move you can possibly make. Here is another real-world tip. If you are the kind of person who forgets to drink, set gentle alarms on your phone. Not annoying buzzers, just soft nudges. 7 a.m. wake-up water, 11 a.m. mid-morning, and so on. After 2 weeks, you will not need the alarms. It becomes muscle memory. Your body will start expecting water at those times. You will actually feel thirsty right before the alarm. That is your body recalibrating. And for those who hate the taste of plain water, do this. Squeeze in some fresh lemon, not the bottled stuff. Fresh lemon adds flavor without spiking your blood sugar, and the electrolytes in lemon actually help hydrate. Or toss in a few cucumber slices or a sprig of mint. All natural. No blood sugar hit, no fake sweeteners. Those actually worsen insulin resistance over time, so keep them out. Let us talk about traveling. This is where most people fall off the wagon. You are in a car, on a plane, bouncing through hotels. Your routine vanishes. Here's the play. Bring an empty, reusable bottle through airport security. Fill it at a fountain past the checkpoint. Keep it with you. In the car, stash a cooler with bottled water in the back seat. In hotels, refill your bottle every night before bed. Travel already stresses your blood sugar. Do not let dehydration pile on. I have had patients come back from a 4-day trip and need 2 full weeks to recover their numbers because they just stopped hydrating properly. Do not be that person. Here is why I am obsessed with this. I have watched too many people suffer for no reason. I have watched too many people blame themselves for biology they did not choose. And I have watched too many people quit because they thought they ran out of options. You have not run out of options. You just had not aimed at the right target yet, and now you have. Cellular hydration. Simple, accessible, powerful, and it works. Let me leave you with this. You do not stabilize blood sugar by fighting your body. You do it by supporting it. Your body is not the enemy. Dehydration is. Insulin resistance is not a character flaw. It is a biological alarm telling you a need is going unmet. Once you meet that need, the alarm quiets, the numbers drop, the fear shrinks, and you get your life back, not because you became a perfect human, but because you finally gave your body the wet foundation it needed to run right. Sometimes the most powerful change is not some fancy protocol. It is finally nailing the basics. And water is as basic as it gets, but it is also as powerful as it gets when you run it right. Timing matters, temperature matters, minerals matter, consistency matters. And when you stack those pieces, you build an environment where insulin works, where cells answer, where glucose steadies, and where you stop feeling like you are failing. Because you are not failing. You never were. You were just missing one critical piece. And now you have it. So here is my dare. Try this for 2 weeks. Just 2 weeks. Hit the 4 water windows, use room temp water, add minerals, track your fasting glucose every morning, and watch what unfolds. Do not change anything else. Same food, same meds, same routine, just stack structured hydration on top, and if your numbers budge, you will feel it. If your energy climbs, you will feel it. If your brain fog lifts, you will feel it. And once you feel it, you cannot unfeel it. You will have proof in your own body that this works. And that proof will carry you forever. I am here rooting for you every step. Take care of yourself, and I will see you in the next one.